Hi, I'm Gwen,
And I'm Margo.
and this is Notes on Arrival.
Today, we're going to talk about unmedicated births. Obviously, on Notes on Arrival, we love to talk to women who've had all different types of birth: medicated, unmedicated, C-sections, VBACs, home births, hospital births. But I think that you and I both got really into like birth because we were just really inspired to have unmedicated births ourselves. And
So, what we
then
want to do
through kind
today
of
is
that
talk
journey, just like learned
about
so much and just
unmedicated birth.
became the birth
And I
nerds that
think
we are
this is
today.
hopefully helpful for people who either want an unmedicated birth, maybe don't know what kind of birth they want and want to understand like how to have an unmedicated birth or how we prepared for unmedicated births. And then also talking a little bit about like epidurals and like why to choose one or risks to consider when you're considering one. So before we get into all that, I just want to talk a little bit about like why we both chose to go unmedicated. So I guess Margo, I'd love to hear from you. Like, what was the catalyst that led you to decide like I want an unmedicated birth and this is the plan that I have for my birth?
I was thinking about this, like I was reflecting on this as we were preparing for this episode. And when I was in my early 20s, I got an IUD put in because I had ovarian cysts and yada, yada, yada. And I'd had a few friends who had gotten IUDs. They all were like, yeah, I mean, like it hurts, but like it's quick and then it's done. And I was like, okay. I took like some Advil beforehand to prep. And the woman, like the gynecologist, was like, okay, so this is going to be very painful. And I was like, yeah, like I know, but like I'm total like hurts a little bit. It's like a little pinch and then it's fine. She's like, no, have you experienced childbirth before? This is going to be very painful. And I was like, okay. So she put it in and she was like, how was that? How are you? And I was like, I mean, it was fine. Like it hurt a little bit, but like I'm fine. And she said to me, she was like, you don't need an epidural. That was not my catalyst for wanting an unmedicated birth. But I think that having someone, a medical professional, tell me at like 25, you don't need an epidural, really made an impact on me and made me believe in myself in a way that, like, I think a lot of women get the opposite. I think a
Mm.
lot of women get like, oh, well, like you might as well just get it. Or like it's incredibly painful and like why deal with the pain if you don't have to, or like you can't handle it. The reason that I wanted an unmedicated birth is because my mom had two C-sections with like me and my brother. And growing up, I feel like it was kind of like drilled into my head, like, don't have a C-section, avoid a C-section if you can. And I also think that we really minimize C-sections and like how intense I mean, it's major abdominal surgery. I
Yeah.
think it's treated like the easy way out, but I don't think it's that at all.
Yeah, the recovery is like way more intense from a C-section than vaginal birth.
So I wanted to do everything that I could to avoid a C-section. And like based on I got my graduate degree as I was like researching more about like C-sections and how to avoid them. What I learned is that there's this very common like cascade of interventions, which I'm sure we'll talk more about. And I was like, okay, my best hope for avoiding a C-section is to go unmedicated. So yeah,
Yeah.
that was like why I was like, I don't want to get a C-section. So like I'm gonna go unmedicated. And I had a provider who like told me that I could handle it. How about you? What was your rationale?
It's funny, my mom had two unmedicated births, so I feel like my instinct was like, oh, like I would do that. And she always spoke like really fondly of her births, like being like it was really difficult and painful, but like it was also incredible and like her births were pretty straightforward, as were mine, luckily. So I think like since a young age, I just was sort of like, oh, like I would do that. Like, why wouldn't I do that? Kind of like for me, that felt like the default. Whereas I think for so many women in our generation, the default is to choose an epidural, to choose a more medicalized approach. The other thing is I'm like really afraid of medical things. And I was like, the idea of someone like putting a needle in my spine is like so terrifying. I felt way more afraid of that than I did the pain of childbirth. I was like, your body's built to give birth. Your body's not built necessarily naturally to like have needles in your spine. That seems crazy. So I don't know. For me, I think honestly, a little bit of it was fear, but like the opposite fear that I think some people experience. Giving birth to me seems like this like wild experience. Like you become a mother, you're literally pushing a human out of your own body. I didn't really want anything to like interfere with my ability to be present
and to like fully experience that. So I think it was like the fear of an epidural, which led me to think like that would be a last option for me. And then also just like the desire to honestly experience it. I mean, I was like, I know it's going to be painful, but I kind of want to like know what it feels like.
You see all the things they'll like list on the internet that's like, what's more painful than childbirth? And we put childbirth on as the like most painful thing you'll ever experience in your life. And like, listen, my first birth, yes. I wouldn't even say painful necessarily. I would say like the most physically intense
Yeah,
experience
like
of my
difficult and
life.
intense and like, yeah, just crazy.
Yeah, yeah, exactly. And painful. Like I think that I commend the women who have experienced pain-free birth. I think that there's a lot of like stuff out there on the internet that's like, if you just breathe and if you do this and you tap into your ultimate femininity, like birth isn't painful. And I think for women who go in their first time kind of expecting that, I think we're misleading them.
I
Um,
agree. I think
yeah,
it's like, yeah, I think that's a little bit like you said, a social media like, and I think there is a little bit of a benefit to telling people like you can have a pain-free birth to sort of like give them the confidence, like how this healthcare provider gave you the confidence of like you
yeah,
don't need an epidural. Like you're like, who are you? You don't know, but like maybe I don't, like maybe she's right. Um,
right.
I think it's funny what you said, like comparing things to childbirth, like what's more painful than that? And it's like you talked about all your friends who said this is a painful experience to get an IUD, and then this provider's like this is a terrible experience to get an IUD, and like you were like this was like an uncomfortable experience, and I think I had like a pretty similar experience, like it was uncomfortable, but I wasn't like screaming in pain, like giving birth was like far more painful than that. But then, like you said, your first birth was like really painful, really intense. Second one, maybe not as much. And I feel like I've had that experience too with two births. Like one was harder and more painful than the other. So yeah, I don't know. It's like, who's to say what's the most painful thing?
Well, and what I was getting at there is that birth is, like you said, a natural process. Like our bodies are built to give birth. But like if you have a migraine, if you have kidney stones, if you break a limb, like all of those things are not supposed to happen. And there's this really interesting thing when it comes to like pain and perception of pain. It's all in your head, like literally, like pain is perceived entirely by the brain. And it is your body sending signals to the brain to say, hey, something is wrong. So,
Yeah.
like, we need to address this. We need to do something about this. Whereas what's happening in childbirth is like, hey, you got to work. Like, you said this to me, and I thought about it, especially in my first labor, but it is pain with a purpose. Like,
Yeah.
this is not like your arm is broken and fuck, you need to go fix it. It's you are giving birth, you are bringing life into this world.
Yeah. And it's like you need to sort of work through that pain. So,
Yeah.
yeah, I mean, it's obviously a really intense experience. And I spoke to a bunch of women, some of whom we've had as guests on the podcast, who I felt like I spoke to Dodie, I spoke to Jenny. I'm trying to think who else. A few other women who we haven't necessarily had on, but they were really inspiring to me and they had super different experiences, even from like birth to birth. But I think it was just like really good to like talk to other women who've experienced it and was kind of like, what did you do to like prepare? What did you do to cope during? And I wouldn't even say that either of them shared things with me that I was like, oh, I did the thing that they suggested. It's just
Mm,
like gathering information and trying to like figure out what's going to work for you. What are your options so that like when you're in the intensity of labor, you're like, what is going to work for me right now? What's going to feel good?
yeah.
Because like I remember my doula brought a TENS machine that has like the
Oh,
small, um, the like electro, what is it called? It's like
uh,
little, almost like sh
yeah.
electric shocks, kind of. Um,
Yeah, I've heard of that. I've never like used one. Was it helpful?
well, I didn't use it because like
Oh,
I knew it
okay.
was an option. I knew it was there, but it just like never, it wasn't ever something that I like wanted, you know?
Yeah.
I felt like for me during my first labor, especially, I wasn't like trying to bail out from the intensity. I was just
Mm,
like, I know I need to lean into this. But I think that was because of a lot of the like kind of preparation that I did ahead of time. I think what I want to do is talk a bit about like epidurals. And
cool.
the reason we're going to talk specifically about epidurals is because that's like obviously the pain relief choice that majority of women choose in not just the US, but like most Western countries. Had trouble finding an exact statistic because I think it really varies. But
I think it's about 75% of women in the US choose epidurals. But even so, like that's a massive majority of people who are choosing to birth with an epidural. I think there's a lot of people who like want to have an unmedicated birth and they're like, this is what I'm trying for. But then there's also a lot of people who are like, I know that I want an epidural. Which I think like if that's your choice, you know, I want everyone to have a birth that they feel like safe and empowered by. So obviously most women are choosing that. But I think it's good to also like have information about like what are the risks, what are the pros and the cons here, so that you can make an informed decision going into getting an epidural versus just kind of blindly being like, oh, everyone chooses that. I really believe that like for uncomplicated births, women who are healthy, babies who are healthy, nothing that's indicating that there needs to medically be like no medical reason to have an induction or have a C-section, why not go unmedicated? You know, like why not try it? And I believe you can do it. If you're listening to this and you're like, I could never, you can.
Yeah, I absolutely agree. And I think it's like, I think it's a matter of like kind of changing the narrative.
But I just think there's a lot that everyone should know, like making that
Yeah.
choice. That said, let's get into some of the discussion around like some of the risks for an epidural. So I think it's good to ask kind of like, what is an epidural? And so it's like a catheter that goes into your spine, and then there's medication that goes through the catheter to essentially like make your lower body numb. And
Hmm.
so there's various different drugs that can be in an epidural, but a very common one that's in probably almost all of them nowadays is fentanyl. So obviously, like our country is amidst a fentanyl crisis. I don't mean to say this in a way that's like fear-based. This isn't going to make your baby addicted to fentanyl out of the womb. There actually is no data around that. There is data to show that like at low levels, the risk is actually very low, that it's going to affect the baby. But it is also good to remember that medications that go through the epidural, they can cross the placenta and they get into the newborn circulation. So while having fentanyl or any other drug in your epidural isn't necessarily going to like turn your baby into a drug addict or like have some devastating effect on their development, it is going into their system. So I think it's just considering like, do I want to have medication, some sort of interruption of just like the natural body and like cycle that the baby's going through during birth, it will cross the placenta. So it is something to consider.
Can I add something about that?
Hmm.
So as you said, like fentanyl does cross to the baby, it does cross through the placenta. It has shown to be detected in newborn blood and urine for over 24 hours after birth. So like it is there. It doesn't, most studies suggest that it doesn't impact breathing at like
Yeah.
typical epidural doses. So if you're getting it at the typical amount, like respiratory wise, your baby should be fine. But it does have, there's like pretty concerning evidence about the baby's ability to root and suckle. So like it can
Yeah.
really impact breastfeeding. So breastfeeding, like the results are mixed. But it is possible that like having an epidural and having fentanyl in that epidural will like basically impact your baby's ability to successfully breastfeed.
Yeah. And like you said, the results are kind of mixed. And what I saw, like anecdotally, there's a lot of midwives and like natural birth advocates who believe that they see an impact on the baby's alertness. So like subtle
Mm.
effects, on like alertness and bonding. The other thing that epidurals do is that they affect your natural release of oxytocin, which is really needed for the milk letdown to begin. So there could be like a delay of milk, just not as much milk. I mean, it's a very delicate process of like baby's born, colostrum, milk let down within the first couple days. So any like drugs in the epidural, specifically fentanyl, can affect that. Um, I will say like there wasn't a lot of data to show like if you get an epidural, you're not going to be able to breastfeed. Like that's definitely
Right,
not
right.
true. I just think it's something to consider as like if you do end up getting an epidural, how is this maybe going to create a little bit more challenge? Maybe then you know, like either I know I want an epidural, I know that can affect my milk. So maybe what I do is I hire a lactation consultant ahead of time, knowing that maybe there will be a little bit more of a challenge, at least in the early days. I also learned that the lower amount of fentanyl that you have, obviously, then the less chance it is of it affecting your success breastfeeding. So Another option is like from what I understand, and honestly, I didn't have an epidural, so I don't know. Like someone out there probably knows better than me, but I believe that you have control over like the dosage of your epidural. Like I think there's oftentimes like you can kind of choose when to like have more medication and coming in through it. So I think being mindful of that maybe during labor, of like, how can I sort of keep this to a minimum to minimize the potential effects?
Yeah, absolutely. That's my understanding as well.
Something else to consider as far as like what to expect if you're planning an epidural or end up with one is like what else comes with it. And you've talked about this before, Margo, but like what else comes besides like having a catheter in your spine? Now you have this kind of like patch on your spine with a needle in your spine and like a cord coming up. What else comes? So you also need to get a bladder catheter. So that obviously goes in like through your pee hole. What is that called?
Urethra, your urethra.
So that goes in through your urethra. Guys, I obviously haven't taken biology in a minute. You also then are required to have continuous fetal monitoring. So if you wanted to be able to like, not be tied up to everything, that's no longer an option. They have to be able to hear baby at all times. IV fluids are required. And then from what I understand, blood pressure monitoring can happen up to every 5 minutes because I think there's a direct correlation between epidural and potential risk of a blood pressure drop. So there's just a lot more monitoring. It's like you think, oh, I'll just get an epidural and that will like really help manage the pain during labor. But really you're signing on for like all these other things where if you're like me or you or someone else who might be interested in like not having so many things attached to you and being kind of tied to the bed, that's not really an option. And I think also that speaking of being tied to the bed, like for the most part, you're not going to be able to move. Your whole lower body is going to be numb. You're not going to be able to walk. You're not going to be able to stand up. You'll probably need assistance to like move around and go into different positions.
Yeah, definitely. And it was really interesting. I had a doula who like I took a childbirth class with her beforehand, and she kind of like had me hold like the broom to be like, this is your IV, and had me like kind of hold everything. And it was just like very overwhelming. And like forgetting the fact that you can't move your lower half anyway, it was like, this is like, I feel completely bombarded by everything. I was also on Reddit the other day, and there was an Ask Reddit that was like, what's something that they don't tell you about like pregnancy or childbirth?" And a lot of women didn't know about the catheter that goes in your urethra. They were
Mm.
like, "I didn't know about that," and then some of them even reported having issues with that. And the other thing that's crazy to me is, as I was prepping for this like episode and for the next episode, I like Googled like everything you should know prior to getting an epidural. And I went on like Yale's website, Mayo Clinic, like all of these reputable websites. Not a single one of them mentioned all of these other things. Mentioned
Well,
like you
evidence-based
getting,
based birth does.
well, we love evidence-based birth,
I was like
but like,
reputable websites, the hospitals.
no, exactly. Like that's the thing that's crazy. It's like, again, I think that that's what we're trying to do here, but like that people just don't know, like
Yeah.
that this
Yeah.
is
And it's
what
like
comes.
they're guarding this information. They're not like presenting you with like, here are the risks. Like, why are we making it harder for women to have informed consent?
Yeah,
Why are we
absolutely.
just
And
saying,
I,
oh, why wouldn't you get that epidural? Don't worry about it. It'll be fine. Like, it
yeah,
probably will be fine. Statistically, like the outcomes are pretty like positive from getting
yes.
epidurals, but like, why not understand what the risks are and the pros and cons?
And not even like the risks, but like what goes with it, right?
Right. What
Like,
to expect.
yeah, exactly.
What to expect when epiduraling. So the other thing is like there's a lot of physical effects that this can have on you, like actual like kind of medical effects to the process of birth and postpartum. Um, Obviously, like we mentioned, with an epidural, it really decreases your ability to move. I think in most cases you're not going to be able to like stand up and move your legs on your own. And because of that, they are correlated with longer labors because if you're not able to move around, that's one of the ways to really progress labor is to move your body, get the baby kind of in different positions in your body as they work their way down. So it is often tied to a longer labor. The other thing is that epidurals decrease the release of oxytocin. So, as we always talk about, oxytocin is really needed for every part of labor and honestly motherhood. So, oxytocin is the hormone that causes the uterine to contract. So, with an epidural, you kind of lose a little bit of that
mind-body connection when you're not able to feel your body and you're not going to be contracting as effectively, which we'll get into a little bit more of the cascade of interventions, but oftentimes that then leads to the use of Pitocin. So, yeah, I think just considering like if I get an epidural, the chances of some of these other interventions increases. An epidural also reduces the release of beta endorphins, which is a natural pain reliever. So, while
Oh,
the
that's
epidural,
interesting.
yeah, the epidural itself is the pain reliever. Beta endorphins are your body's version of that. From what I understand, epidurals are probably a lot more effective than the beta endorphins.
Also from personal experience.
Just from personal experience. But yeah, it does like obviously impact your body's ability to release certain hormones and endorphins. But also those endorphins and hormones also often help with like the bonding, the breastfeeding, all the things that we just talked about. The last thing for like body, kind of like what it can do to your body that I thought was really interesting is that it affects the uteropituitary reflex. So the pain relief from an epidural can disrupt the normal feedback loop between the baby's head pressing on the cervix and the release of oxytocin. So this can potentially lead to weaker contractions and slow labor. So that's kind of like overall like why some of this stuff is happening. Like without the utero-pituitary reflex, your body isn't going to as effectively release oxytocin, and then the contractions won't necessarily be as strong.
My understanding too is that with an epidural, you have increased risk of instrumental delivery. So basically the
Yeah,
use of like
that
vacuums or forceps. Yeah.
yeah, yeah, for sure. Yeah, so let's get into that a little bit. What you were talking about earlier, Margo, the cascade of interventions. So
Yeah.
when you introduce any sort of intervention, an epidural being a type of intervention, you increase the risk of other interventions. If you get an epidural, it doubles the risk of needing an assisted vaginal delivery with tools like forceps or vacuum. So I think that was actually a stat that like shocked me because I was like, it doubles the risk of needing a vacuum or a forceps. And the total rate of assisted vaginal delivery is 3 to 5%. So it's still a relatively low percent, would be my understanding, especially because so many women in the US choose an epidural that rate probably includes epidurals. But regardless, it's not nothing, and I think it's something to consider because forceps and vacuum can lead to other complications. In my opinion, those are the scariest interventions.
Yeah, I agree. Like I'd almost rather have a C-section.
Yeah, same. Another potential intervention that you have an increased risk of is Pitocin. So you have a 30% increased chance of needing Pitocin during labor if you choose an epidural. Um,
Wow.
and that's a pretty high increase. And then something else I wanted to talk about was the increased risk of a C-section. So in the 80s and 90s, epidurals were like a much higher dose. I mean, they were new in the 80s. So there was probably a little bit of experimentation going on there. And there was a pretty direct correlation between receiving an epidural and needing a C-section. But now that epidurals are lower dose, and I think they've really refined like how they're administering them and what is being administered into the body, there actually is no longer a direct correlation between getting an epidural and getting a C-section. But it does increase the risk of other interventions, forceps, vacuum, Pitocin, and I think those are things that are they do affect the body and they do affect the baby, and they do pose risks. So just something to remember if you're choosing that route, and just kind of thinking about like, am I willing to assume like this increased risk?
Yeah, definitely. Thank you for doing
Um,
that research for us.
yeah, for sure. I want to talk a little bit about getting away from like the numbers a little bit, but talking a little bit more about like kind of the mental and like emotional effect that that can have. Like when you are feeling in control, like when you don't have all these things attached to you, when you can feel your entire body, that being in control lowers your perception of pain. So while neither of us are sitting here denying that birth is painful and promising every woman she's going to have a pain-free birth, I think that there is some sense of like, I'm able to control the situation. I'm able to manage this pain because I'm the one kind of here choosing how to move my body, like kind of choosing this state.
Yeah, definitely. I think that For me, it was much less being unmedicated that helped me kind of like mentally cope in labor. I think when I compare like my hospital birth to my home birth, like the home birth, I mean, also granted, I don't know if I can really compare them because my hospital birth was 2 days and my home birth was 8 hours.
Yeah.
But like when I was at home in the dark, like in my own space with people who I had like very intentionally invited into the space, I perceived a lot less pain
Yeah.
than when I was in the hospital under the bright lights with people coming in and out of the room with all of the machinery that was like very much in my face. And I think that like if you choose to go medicated, like you don't there are things that like your doula and like other your like birth support can do to kind of like turn the lights off, bring fairy lights, like that kind of thing. But like you said, I think you lose control. You give up a lot of control for
Yeah.
that like medicalized pain relief.
Yeah. I think too, like something that we haven't talked about is that like a lot of women will choose an epidural and then it's like doesn't work. I've heard so many women
Yeah.
being like, it didn't work, or it only worked on half my body. I've heard that a handful of times. So, not to say that like everyone needs to fully prepare for an unmedicated birth, but like I think you want to be prepared enough and create an environment that you're comfortable enough in that, God forbid, you choose an epidural and it doesn't work. You don't feel like you got cheated and you don't feel
Yeah.
like completely out of control. Like, I didn't prepare for this. I didn't want to feel anything. And here I am feeling everything. Prepare for and expect to feel something so that you can like set yourself up for success and not feel like traumatized by the pain and intensity that you might experience.
And I also think that like we've had some women on who have talked about, and like I've heard this from friends too, who have talked about how like they got the epidural and it worked, but it was still painful. Like childbirth is like it is a lot of fucking work that your body is doing. Like
Yeah.
I think going into it and like expecting either with like medical intervention or without and expecting it to be like pain-free and this kind of like fun experience, I think that you need to kind of like manage your expectations there.
Yeah, 100%. I want to talk a little more about like the baby and mom connection, not from like a data perspective, but really more of just like speculation. Like, what really happens when when you can't feel the baby? Like, you can't feel
Yeah.
the contractions happening, meaning you can't like actively feel your uterus. So, in theory, baby can't feel you and doesn't have that, like there's not that communication going on between both bodies. What does that look like for the baby? Like, is it terrifying? Probably. I
Yeah.
mean, I don't know. Like, I guess what are your thoughts? Have you like heard anyone talk about this in a way that feels interesting?
Yeah, I mean, I think it's something that is like I think it's something that we're never gonna know, right?
Yeah.
We're never gonna fully know. And I think it's really interesting when like we hear things like dogs dream about these things. I'm like, how the fuck do you know? Did you ask them? Like, I don't think that we're going to be able to like ask babies and like get an answer, right? So I think it's a very difficult thing to like know intellectually. That being said, no, like I don't know if intellectually is the right word, but it's something that we can't like objectifiably measure. I think about the birth with my daughter and how like once my water broke, I got in the tub and I remember pushing and like I wasn't like talking to her, but I was really just like honed in on my body on where she was. And like I pushed very slowly and very thoughtfully and very intentionally. And like I did not tear
Yeah.
with her. And I think that like, and then when she came out, like I just like I felt so happy and I felt like such a rush that like she was there and it felt like something that we had done together. It didn't feel
Yeah.
like I gave birth to you. It felt like we just went through this crazy intense experience together and like you worked and I worked and we did this together.
Yeah.
Um and I just like I don't think I would have had that experience if I had had an epidural.
I think that's such an amazing like way to think about it. And yeah, I mean, it's true. Like both mama and baby are working really hard. That's such a beautiful way of perceiving it. And I think also just like mentally preparing for that and really thinking about that while you're birthing, especially while you're pushing,
Yeah.
is such a good way to like start to prepare for that like first moment of bonding.
Yeah.
You're like, we're in this together. Like we're essentially one.
Yes.
I love that. Um, Another thing that I think about a lot, and I mentioned this early on as like one of my motivations for choosing an unmedicated birth, is like this is the biggest transformation that any woman's going through, especially if like your first, or honestly, anytime you give birth. Like it's
Yeah.
this massive transformative moment. Um, and like, why wouldn't you want to be fully present for that? Think about how you want to mentally show up for that moment. And if like having full clarity and having fully like being aware for every moment of that, however painful or intense it may be, like the moment after baby's born or even during labor, like I think being fully present for that really is this incredible experience. And I don't know about you, but like after giving birth, like I think the best I've ever felt in my life is like within the first 10 seconds after giving birth. And then like the several hours after that of just being like, holy shit, like I just did that. Like I'm amazing. And now I have a baby. And like there's just this high that like I've never experienced from any intoxicant I could think of that I've tried. You know, like
I
that is the ultimate high.
I love that. I don't know if that was my experience, to be like fully transparent.
That's
Like
fine.
I like the moment that both of my children were born was definitely like hands down the best like moments of my life. I don't remember, especially with my first, because like I was in labor for 2 days. Like I don't remember being like, I feel amazing. Like I didn't feel that way. I felt like, holy fuck, I'm gonna do this again. Like this is crazy. After my daughter was born, I remember it a little bit more, but like also like it took an hour for the placenta to be born. Like it was, but I do remember after the placenta was finally born and everyone left, I just like stared at her in bed and I had such a like adrenaline rush and I was like texting everybody that she was here and that was amazing. Like I remember that very vividly. And I always say my daughter's birthday is in June. I was like, it was the most beautiful day. I did not go outside that whole day. I have no idea what it was like outside, but like in my head, it was like the perfect 75 degrees, no humidity, sunny day all day long. And like I have no idea. So I think that like there's probably something there. But
Yeah.
I do want to say that I was honestly, especially before my first birth, really afraid of transition,
Mm.
which is the moment when you go from like what early to active labor, I forget. And I was really afraid of, I think when you're in birth, I think any kind of birth, but especially if you're going unmedicated, there is a certain amount of like surrender that people talk about. And you have to kind of just like give in and you don't have control. You don't have control of what your body is doing. You don't have control of what's going on.
Yeah.
You just have to like ride the wave. I was really afraid of that. I was like petrified of what
Like
that would
you
feel
were
like.
afraid to feel out of control.
Yes, yes. I was
Yeah.
very afraid to feel out of control and to feel like my body was kind of like taking over and I
Yeah.
couldn't like have a like grasp on what was going on and like couldn't control things. Like kind of how like when you're sick with like a stomach bug, like you just got to throw up. Like you have no control over the situation. It just is what it is. I think an epidural, I don't think it would have solved that, but I think that there's a certain like when there is any sort of what's the word I'm looking for? Synthetic control of a situation that like maybe you know what to expect and like what's going on a bit more. And
Yeah.
like I think that that's particularly true for the providers, right? Like
Yeah.
if the woman is like if you can control like okay, we're going to give her the epidural and she's going to be numb and she's going to be in this position and then we're going to give her the pitocin which is going to up the contractions, right? Like
Yeah, they can like they know what to expect from
yeah,
having more control.
yeah, exactly. And I feel like that was kind of my experience, especially in my hospital birth of like, oh, you're not going to go medicated. Like, we can't control the situation in the same way. So I guess like all of that, I'm rambling here, but I want to say that like there's a huge aspect of surrendering. And like ultimately, were there moments of like both my births that were scary? 100%. But like, I think that being present afterwards and being fully able to like stand up and walk around, not that I was doing that a ton, but like feel my legs was absolutely worth it. And to be fully present with my children at the moment that they like entered this world, 100% worth it.
Yeah. Yeah, for sure. I also feel like I most people that I know who've had unmedicated births like love birth. I mean,
Yeah.
will admittedly be like birth is really harder. I had a really challenging birth. Like Sophia talks about like her birth was super hard. Like even
Yeah.
her HBAC was super hard, but like she still felt like so empowered by it. And like you and me and like so many other women we've talked to and just like other friends that I have that are really into that birth unmedicated and are just like really into birth. And I'm like, there has to be something there. Like if all of us that are like choosing to do unmedicated are like, birth is fucking cool, like try it, you know?
There is something too of like, we're undecided on if we're going to have another kid. And there's a part of me that's like, I've had two healthy pregnancies, two uncomplicated births. Like, if I have a third, am I pushing my luck? But then there's this other part of me that's like, all right, I've done it twice. Like, how
Yeah.
good can I do it a third time? You know?
Yeah. You're like, I know. I remember
I'm
after
like,
my second birth, the midwife was like, she was like, you just pushed her out in 20 minutes and she was sunny side up. Like, and she was over 8 pounds. So she's like, if you have a third, like they're gonna fly right out of you.
and that's the thing that I think I was here too. Like women who have a third, especially when they've been unmedicated, it's like I just coughed and the baby fell out.
I mean, that sounds great. I would love that. Then I would maybe consider it. Because just kind of like wrapping up some of the stuff we've talked about, I think one thing that's really interesting is just like as a society, we've shifted so much towards medicalized births. And
Yeah.
the vast majority of women, I mean, almost everyone is birthing in a hospital. I think it's what, 2% that are birthing out of hospital.
Yeah. 2% home births. I don't know
Oh,
about
okay.
like out of hospital. Yeah.
Okay, yeah. So maybe like with birth center, it might be higher. Maybe it's like 3 or 4, who knows? But anyway, I'm sure it's like way more than 90% of women are birthing in hospitals. And then of those women, at least 75% of them are choosing an epidural. So it's
Yeah.
like what happened that we made this shift that this became the default? I think not just like why did that happen, but like why is unmedicated birth so uncommon now? And I think for me, I feel like a lot of that is just like the narrative around birth and like
Yeah.
what women are told by providers, especially. And honestly, telling to each other because we both have experienced instances, especially before our first births, where people were like, oh, like just wait until 7 centimeters, or like, oh, you're not going to get a medal for that. Like being really discouraging and for no, it's like you don't know me and what I'm capable of or why I'm choosing this. And you're just like already placing your experience and your judgment on me in a way that in
Yeah.
other instances, like people don't really do that.
What I hope people listening take away from this episode is like, you can do it. You absolutely can do it. I think that like 99% of women can go unmedicated. And for the 1% who can't for whatever reason, because there are reasons when like it's a very good option, and induction is a whole different story that we're going to talk about. You can do it. If you choose not to, that's okay. That's your choice. But like, I think that there's this, it's like, okay, we hit puberty, you get like a pimple, you get some acne. It's like go on birth control. Like let's
Yeah.
medicalize this from jump. You're on birth control, you come off of birth control, you're trying to get pregnant. Maybe you need some interventions to get pregnant. Now you're pregnant, you have this whole birth, and then like you go into labor. And it's like all of these ways that we're trying to control and sanitize and like be in control of the situation. And like in today's world where like everything is at our fingertips, we have so much data and knowledge and like you can order something. I always think about like I ordered bows for my daughter. They came the next day. Like just silly little things where there's
Yeah.
this like we have control over so much of our lives. And in birth you don't. You don't need to like medicalize every aspect of like your life.
No, I completely agree. I want to end this by speaking a little bit to people who like want to go unmedicated or
Yeah.
either like I am 100% dedicated to going unmedicated or this is an option that I really want to try for. And like
Yeah.
if I end up with an epidural because my labor is super long or something comes up where this is a better option than going unmedicated, like I'm open to it. But like I think I would love to just like encourage more people to like just try going unmedicated because you know what? At the end of the day, like if you're in a hospital and you choose an epidural because that's a better option for you in that moment, like then you have that option. But why
Yeah.
wouldn't you go into your birth saying, I want to try going without one because I know my body's capable because Gwen and Margo told me that it is.
Yeah. The other thing that I was going to say before is I watched a lot of YouTube videos the first time around that were women who had both medicalized and unmedicated births. And I think all of the ones that I watched, the women were like, if I have another one, I will go unmedicated again. So I think like check Gwen and I are coming from a place where like we haven't had epidurals. We don't know what it's like. check those videos out. Like
Yeah.
people have had both experiences and like what they say about it, I think is really interesting.
Yeah, I think that's super smart. I love that. And I've like personally spoken to women who've experienced both, and almost all of them have said, I would go unmedicated. I know one woman who was like, had a precipitous birth and she wasn't planning it to be unmedicated, and she was not really happy about it. She was just like, it was super painful and intense, and I really wanted an epidural, but I didn't have time.
That's crazy.
And she's like, if I did it again, I would absolutely get the epidural.
Fair.
Which I was like, I mean, you experienced both, so now you can like really come from an informed place of like what is better for you.
Yeah.
Yeah, I think last thing for anyone who really wants to have an unmedicated birth, like what do we recommend as far as like preparation and like getting ready for that and also just like empowering yourself? I think the things I wanted to mention are just like hiring midwives is better than hiring OBs. They're much more supportive of physiological birth. They're also more trained in it.
Hmm.
So they'll be able to support you, like I believe, more safely during birth for that type of birth. Hiring a doula. And we've even spoken to a lot of women who chose a medical birth, like who had an epidural and they chose doulas and they had still such amazing outcomes with a doula and an epidural. So I think everyone should get a doula no matter what, but especially if you want to attempt one without an epidural. I think having a birth plan, and I think on that birth plan, say no to continual monitoring. I feel like that's like one of the main things that I would always recommend, unless there's a reason that like the baby's heart rate is like not normal and they need to do it. By default, it should be a intermittent monitoring. And also, like people say, like, forget about your birth plan. You have no control. Well, I don't believe that. I think in some instances you don't have control if some medical emergency occurs. But I think in most situations you do have control. But I think your providers don't want you to believe that and they want to be in control. So they're like, I don't really care what your plan is because I have my own plan today. I think hiring a doula is a great way to have a birth plan and have someone there advocating for you to stick to that birth plan unless medically necessary to, veer to another direction. And then the last thing I was going to say is also just like preparing mentally and physically, just like you mentioned, listening to stories of women who've had both types of birth, like listening to why they liked one versus the other. And that might be like some good reminders of like, I'm choosing this for a specific reason or because I know that like this might be harder, but like ultimately it could be better for X, Y, and Z reasons. And also just like checking in with yourself, like, why do I want this? Why is this important to me? And trying to like stick true to that even when it gets really challenging. And then also just physically preparing, like staying strong, staying active, staying limber, doing as much as you can to just like stay in shape while you're pregnant, I think really does prepare you for birth because it's the ultimate freaking marathon of life.
I honestly feel like we could talk for an hour about like preparing for birth.
Yeah.
Like I feel like that's a whole thing, and I like maybe we should and will, but I want to touch on a couple of things that you said. One, agree 100% on hiring a doula. I think that like when we talk to women about like I think like, we've had a number of women on at this point. We've had like over 30 episodes, I think. And like the advice that comes up, I think more frequently than anything else is have a doula.
Yeah.
My doula in my first birth, when I was like saying out loud, I don't want an epidural, she was like, you would have to sit still for 15 minutes. And I was like, fuck no, I can't do that. So, like, having someone who is not your partner, right, who like has never been through this before, but who can kind of help you navigate it. The other thing is like, I think that birth plan is probably the wrong word. I think birth
Birth
outline or birth flow chart is even better
birth
because
dreams is what I've heard too. Birth wishes.
birth wishes, the reason I say like birth outline or flow chart is because you should have a birth plan. Your birth plan shouldn't be, I'm going to go into labor spontaneously and like don't say the word epidural in the room and I want dim lights and fairy lights. I think it can have all of those things if those are your wishes. But what I think it should be rather is I am going to aim to go like start labor naturally. If XYZ thing happens, then ABC, right? Like if I end up, I had a birth plan for my home birth that was like, if I end up having a C-section, I want the curtain down. I want my husband in the room. I want this. I want this. I want this. Like, if I end up having to transfer to the hospital, I want XYZ things. Like, I think outlining and mentally preparing yourself for all of the possible outcomes is really important.
Yeah.
Um, so 100% agree on like I think having and any doctor who says to you like you don't need a birth plan, I think is like
Gaslighting you.
If you have hopes and dreams for your birth, you're not going to get them. And then, like, yeah, there's a ton of like physical and mental prep that you could do for your birth. And then I think that you should do regardless if you're planning on going like unmedicated or not. Like,
Yeah,
I think
100%.
staying physically active in your pregnancy is like one of the best things that you can do for yourself.
Yeah, I think that like staying physically active and fit during pregnancy probably has like that's more important than whether or not you choose an epidural during your birth. I think like
Yeah.
that's probably more important than any of this. And also, like I mentioned before, like sometimes epidurals don't work. So like even preparing mentally for an unmedicated birth, even if you're like, I'm most likely going to get an epidural, but like, what if I don't? Or what if I don't have time? Or what if I get one and it doesn't work? Like, how can I be prepared for this like intensity and this transition in my body?
Yeah. I read this book, Birthing from Within, for my second pregnancy, and there was this quote that I'm gonna botch right now, but it was something like labor is hard work, it is painful, and you can do it. And I like wrote that out and like stuck it on the wall.
Yeah,
And like
I love
that
that.
was such a good, I don't know if I ever looked at it during my labor, but it was just like just the process of like reminding myself of that made a huge difference.
Yeah, I love that. I think I'm hoping that like every listener walks away from this episode just thinking like you can, I want everyone to know like you can have an unmedicated birth. Don't let
Yeah.
anyone or anything in society doubt you. Like don't doubt that you can do something hard. Like you just said, it's
Yeah.
hard work, it's painful, but you can do it. And I encourage people to try it, honestly. I encourage everyone to try it. And for people who know for a fact that is not for me, I am not trying that. You guys are fucking crazy. Then at least listen to this and hear a little bit about like the risks involved in having an epidural. What is the increased chance of some of these other interventions? And just understanding so that you can have the informed consent of getting an epidural versus just being coerced into doing this in a really vulnerable moment.
Yeah, definitely. And I guess the last thing that I would want to say is that like if you want to go unmedicated, I guess two things. One, don't say like I'm going to try to go unmedicated. Say I'm going to go unmedicated because I think the like mental prep that you do is really important. And then the other thing is that like if you want to go unmedicated because you have all of these forces stacked against you and like societal pressures and maybe pressure from your provider and this that and the third, like you need to prep. You need to put in prep. You can't just like hope to go unmedicated.
Yeah, I completely
You
agree.
it's work and it takes time, but you got to do it.
I love that. All right. Thanks, guys.
If you found today's episode valuable, show us by leaving a 5-star review and be sure to follow us wherever you listen to podcasts.
The best way that you can support us is by sharing Notes on Arrival with your friends and family. So send this episode link to someone that you love.